Hello, everyone. It's quite a lot of people here today. Thank you for joining us on your Valentine's Day. Hopefully, it will be a very educational and informative one. Okay. Here. There's a total of 9 people. Welcome. All right. So, should we get started? Okay. So thank you again for joining our second webinar of our 3-part series on plastic pollution and climate change. It's called Breaking the Plastic Cycle, Solutions for a Cleaner Future by Climate Tracker Asia in collaboration with Breaking Free from Plastic. My name is Ashley Yeong and I'll be moderating this session today. So a little bit introduction about myself. I'm an independent journalist based in Malaysia. My stories on environment and current affairs have appeared in local media like the Malay Mail, Southeast Asia Globe, as well as a small environmental site, Makaranga. I'm also a former fellow of the Climate Tracker Asia. It's a wonderful nonprofit journalism organization that supports journalists and storytellers in the region to create impactful climate stories. In today's webinar, we will be discussing the risk plastic poses to human health at every stage of its life cycle, the effects of waste imports to communities in Asia, as well as microplastics in rivers and its impact on communities. Also, stay tuned until the end because Climate Tracker Asia and Break Free from Plastic will offer exciting story grants to journalists and other communicators who can and are interested to produce multimedia reports on the topics discussed in the webinars. So I will be sharing more on that towards the end of the webinar. And without further ado, for today's webinar, I'm joined by 3 esteemed panelists, and that is Ramon and Pascual from the Healthcare Without Harm Southeast Asia, Peng of Kuala Langat Environmental Action Group, Daru Setyorini of Ecological Observation and Wetland Conservation, also known as ECOTON. Each speaker will have 7 minutes to present their topic. After their presentations, we'll have a Q&A session, so please type your questions in the chat window and we will get to them at the Q&A portion. By the end of the webinar, we hope you will understand more about the impacts of crisis on the health of people and the planet, as well as genuine solutions that we can use to address the waste problem. So to start this conversation, let's welcome Ramon and Pascual, who will tackle the toxicity of plastics and its impacts on human health, as well as effective policies and demands for the Global Plastics Treaty. Ramon is a population health and environment policy advocate. He's currently the executive director of Healthcare Without Harm Southeast Asia. He has helped inform, strengthen coalitions of advocates for health and social justice across the Asia-Pacific region. Okay, Ramon, take it away.
Thank you so much, Yung. Good afternoon, everyone. My assignment is to discuss the impact on health brought about by plastics pollution. As mentioned, this is the work that we do in Healthcare Without Harm to oppose and minimize impact of plastics pollution in healthcare. So let me start. I hope my is it moving? Yeah. On my slide 1, it is admitted, and the presentations I'm making here are mostly coming from the paper that we prepared for the INC1, where we participated, and also part of the paper that we submitted already as an intervention for the upcoming INC2. So first of all, on healthcare dependence on plastics, in as much as we know that there is 60 to 70% in the Southeast Asia healthcare waste that is of plastics, then it tells you how much dependence the hospitals have or are onto using plastic, whether in their medical equipment, in their day-to-day medical supplies, in their protective gears. And yet, many of these plastic healthcare products contain toxic chemicals, and doctors know that these have endocrine disrupting or carcinogenic mutagenic, and reprotoxic properties, all harmful to human health. And it is also not a secret anymore that microplastics have not only penetrated our ocean, but even the human bodies, including the lungs, placenta, and in the blood. The thing about the how plastics penetrate our body, whether by the toxic emission or through the microplastics, the most vulnerable group are those that are still in their fetus stage, the young newly born, the infants, and children. Now, as Healthcare Without Harm, we take this precautionary measure. Since there is no safe level, then let us just make sure that no exposure gets into the body of human individuals from toxic chemicals emitted by plastics. Now, and yet, we're not only talking about plastics in healthcare. We're talking about plastic as at each stage of its life cycle, where it damages human health. For example, when plastic is produced, it is extracted and refined and manufactured from a highly polluting processes from fossil fuel that impact the most vulnerable communities and their own health. That's right away a health impact to communities where fossil fuel is extracted from which plastics are derived. Now, increasing plastic production, consumption, and disposal also damages our climate, and the ultimate impact of the climate crisis is on the health of people. It has been said way back in 2015 that the climate crisis is a health crisis in itself. Therefore, proliferating the use of fossil fuel to produce plastics undermine climate, and therefore it undermines even our sustainable health goal. The adverse impact on health are associated with poor waste management. Now, going back to the practices inside hospitals, the more use of plastic is in healthcare, then it also contributes to the worsening waste management practice in the healthcare sector, which therefore would mean exposure to infectious pathogens and toxic substances. Now, I already mentioned that the health crisis is also coming up from the climate crisis. Now, we should not distinguish climate and plastics, for they are all impacting on health, and plastic worsen our climate crisis. Now, in the study we made in 2019 as Healthcare Without Harm, we realized that the health sector contributes more than 0.44% of the net global greenhouse gas emissions. Such that if it is a country, we are the fifth largest emitting country, the healthcare sector. Now, where does it come from? That huge emission coming up from hospital and the entire healthcare sector. 71% of such emission is from the supply chain. Production, transportation, the use and disposal of products for healthcare, including fossil fuel-derived products like plastics. So plastics contribute big deal to the climate crisis, which worsens the health condition, especially those people in the margin. Now, of course, what brings about that kind of dependence of healthcare to plastics is the low price of plastic and its relative ease of manufacturing. And the tendency, therefore, just like in any other sector, is to have an overuse or abuse of the use of plastic. And yet, 1/3 of healthcare facilities all over the world do not have the basic waste management facilities. So right away, if you use unnecessary plastics in hospitals, you also dump so much toxic plastic which is either burned or just left to the environment. Now, for those that were burned, because many countries incineration is legal, in the Philippines it's not legal to burn waste, but there is so much push on WTE. For those being burned, of that waste produce a huge range of harmful pollutants that is again emitted into the atmosphere that comes back to the human health as a matter already of diseases brought about by volatile organic compounds and other hazardous substances coming off from incineration. Now, I should also reveal in this forum that there is a tendency, even from advanced countries, for healthcare sector to exempt themselves from protecting the environment for purposes of promoting health. After so many huge and harmful practices by the healthcare sector, therefore, that should not happen again in the case of single-use plastic, which is one of the prime, the central discussion in the ongoing INC negotiation. The healthcare sector, in a way, helps to sustain the single-use plastic industry, since it is a major consumer of medical textiles, single-use plastics like what we used during the time of the pandemic, the medical and non-medical products, including what comes out in our audit in the hospitals over the past years. The most common type of plastic is used for food packaging inside hospitals. So that should also be addressed and should be reduced. And none of this should be made exempted simply because it is being used in hospitals. Now, since we have few minutes left, I just want to move forward. Therefore, what is the position of the healthcare without harm as we move now to the next stage of the global negotiation to ban harmful plastics and to reduce production of plastics? One, we ourselves in healthcare without harm, we don't seek exemption for plastics in healthcare. In as much as some in the healthcare sector would say, because we are promoting health and we're treating diseases, we should be allowed. We said no, because of the many instances where allowing the healthcare also lead to further damage to health. Therefore, in the plastic treaty, healthcare products should be covered as part of the core obligations. Just like in the Minamata Convention, healthcare is no longer exempted in the phase out of mercury. There should be transparency in reporting what is the chemical composition and what constitutes plastics that is harmful to human body. And therefore, there should also be a mandatory action throughout the full plastic life cycle. It is not only in the disposal where plastic is harmful, it is from the very time that it is extracted from as part of the fossil fuel extraction. Phase out the unnecessary and unsustainable plastic products in healthcare. Incentivize manufacturers, hospital administrators, the healthcare sector, the Ministry of Health to redesign plastic equipment and products used in hospitals. And producer responsibilities should be made meaningful so as to really reduce plastic pollution and be able to promote human health. What are the implementation measures? If healthcare sector is not exempted, therefore it should also be required to comply with the very highest of the standards, without exemption, without delay, in all aspects of plastic pollution prevention. This is what we mean that the healthcare sector should not be exempted from whatever type of plastic, just because we are treating diseases. Improve understanding of plastic in healthcare through monitoring, research, audit, increase transparency, including through mandatory product labeling to disclose polymer and additive content of plastic materials in hospitals or in healthcare. Educate the healthcare professionals on the impact of plastics, whether on public health and then environmental health, because they go along anyway, and therefore how to reduce it during their working lives as professionals, as doctors, as nurses, as laboratory people, as engineers in the hospital. If each one has a role in reducing dependence on plastic. Audit plastic use and create a plan to reduce plastic consumption and sustainable use and disposable practices. And one last measure that we are already doing for the past years now in certain hospitals, in certain countries across the globe, in partnership with the UNDP, is to start off from the procurement. And therefore, there's a need to set procurement policies to favor the most sustainable plastic products. There is such thing, and review procurement practices based on the latest guidance and best practices until dependence on plastics in healthcare is cut off. Thank you very much.
All right, what a great start to our webinar. Thank you, Ramon, for drawing the important link of the healthcare sector and the toxicity of plastic and our dependence on it. So now we'll move on to our second speaker, which is Peng. She's a chemist and a founding member of the Kuala Langat Environmental Action Group in Malaysia. She's instrumental in spreading awareness about the illegal plastic waste dump sites and burning sites in her hometown of Jenjarum. Through her team's effort, more than 300 illegal facilities responsible for burning and dumping plastic waste were shut down. The story of her grassroots activism has been covered by international media outlets such as HuffPost and allowed her to meet former New Zealand Environment Minister Eugenie Sage and attend international conferences. She'll now talk about the impacts of waste imports to communities in Asia and the challenges of plastic recycling. Wow.
Hi everyone, thank you for the invitation. My name is Peng. Okay, I come from a small town in Malaysia, Jenjarum. In year 2018, okay, my community going through a very terrible nightmare about waste plastic pollution. So the story starts from there. I become an activist, and for me as a chemical engineer, I know well, the harmful and the dangerous how the plastic waste will impact us. However, for my community, a lot of residents, they actually know nothing about that. So we have gone through a very difficult time. So today I would like to share from my point of view as a chemical engineer, as a local resident, how my feeling and also what happened to my community, that the plastic recycle process impact to us, to our health in our life. Okay, go further. When it happened that more than 30 illegal plastic recycle factory and more than 5 legal plastic recycle factory, it's all imported plastic waste, that they're running the process surrounding my community within 1 kilometer and within 10 kilometers. So it happened a lot of children and adults. They fell sick. Most of the symptoms that is about respiratory system problems. For example, we fell into continuous repeating coughing, itching, allergy, and this lady coughing non-stop until bleeding, and she need to admit to the hospital and to the ICU. The doctor said she has very weak immune system, and so when this happened, I started my study into the plastic recycle process, and I found that since year 2013, you can see that Malaysia start to import double up, triple up amount of plastic waste. And at the same time, it also happened that the cancer rate increased since year 2013 in Malaysia. So I studied this data, and I tried to see what happened to my community is recently, yeah, when because my community is relatively small, about 30,000 people, and I found that in 1 year, there is more cancer patient passed away or cancer rate happened in my community. So how high the difference compared with before year 2018? From my observation, it's about 4 to 6 times that cancer rate increased in my community. So our story I reported in many international media, so we get attention from BBC, CNN, and also Greenpeace. So Greenpeace not only have a started survey in Malaysia in year 2018, but they also did analysis testing, collect those sample or those substance that happen in some community or site that happen burning plastic, dumping plastic, extra. So this is one of their conclusion about what is their finding. Not only the metals content, but also organic pollutant that is also contaminating our water and our soil. So this is one of the data shown in their report. I was shocked and feel very sad is, okay, these two locations, MY19020 and MY19021, actually happened just very nearby to my community, less than 2 kilometers. So there were 100 tons of shredded plastic waste being burned, okay, in year 2019 January. So the burn sample and soil being studied and found that it contained very, very high toxic chemicals like lead that can up to few thousand ppm, and also zinc and also copper, aluminium, arsenic. So all these tell me that actually my community surrounding my most land is called agricultural land. So that means that the pollution also already go into our underground water and also our food chain. It is a non-stop story because Malaysia now already become highest plastic waste importer for many countries, for example, Japan. So if you ask me, okay, after our campaign, we fight against them, we achieve some good result is like we attract a lot of attention from international, but also our government. Yes, a lot of action taken, they close down some of the illegal factory, but reversely, why it happened now in Malaysia, we still the highest plastic importer. I think it's because there is a lot of loophole in Malaysia law. So even though to import plastic waste to Malaysia now is more difficult, they have 18 regulation and law they need to comply. But recently I found that more company they apply to recycle so-called local plastic. Okay, but if local plastic has enough amount for them to process a recycle plant, why we still need to import plastic waste from overseas? So actually the story behind this is a lot of plastic still smuggling in to Malaysia and supply to them for them to do the recycle. So I show this picture is happen every year in Malaysia. Every year, at least more than 10 cases fire from plastic recycle factory. Do you think this is just an incident case? Accident case? No. From my point of view and from our investigation, the fire is happened. I think mostly it's just to clear out that for those non-recycled plastic to be disappeared, and it happened in a site accumulate a lot of plastic waste. When the fire happened, it's a very, very big fire for a few days. But the conclusion from our country's environment department still saying that, oh, the fire not causing air pollution. Okay, but from my observation, in Malaysia, respiratory system problem, I think is a major concern to parents, because a lot of the children, because children or young age people or elderly is the vulnerable group that they have a lot of symptoms show that, okay, they are not feeling well always due to the air pollution. However, in Malaysia, as a public, we cannot get, like data about the air pollution. The government always show us that moderate situation, the air pollution is just moderate. But I don't believe that. I really don't believe that, because when there's a big fire happen in just about 1-2 kilometers away from my house, I can see the black smoke, but my environment department staff still saying that no air pollution. So this is another terrible air pollution just happened about 1 month ago in the north of Malaysia, that non-recyclable plastic waste been dumped and been burned. So in Malaysia, it will always just treat as a accident case. So this is how the factory runner, when they want to clear the waste that without paying cost, this always happen in Malaysia. So besides this, is it any other channel that plastic waste also coming into Malaysia and create impact to our health? Yes. Recently, our study found that Malaysia start to going to import a lot of paper waste. From the EIA report that I read, about 5 to 7 EIA report I read, Malaysia will import more than 10 million tons of paper waste from the other country. One of the factory already start just nearby my house, about 5 kilometers away. So we get information and proof showing that this is how their waste look like. So if you think this is a paper waste, they also contain a lot of plastic. Some of EIA show that the factory will import paper waste mixed with the highest 20% of paper waste for plastic waste mixed inside. So this is one of example that the vulnerable community, including school and the resident area. Can you imagine this factory? The EIA already been approved to build incinerator, and the distance between the school with the chimney of the incinerator less than 500 meters. And even though we send our objection letter to advise them not to run this plant just so nearby to the school and residential, all our voice just being ignored. So in this community, can you imagine another 2 paper recycle plant which will burn a lot of plastic waste which mixed in the paper, were already also approved and will be running start from year 2024, something like that. And one of the plants clearly show that every day they will burn close to 1,000 tons. So this area in coming years, the community here, the school student here will bear the air pollution impact from 3 incinerator and also 3 coal power plant, because paper recycle factory, they need a lot of energy. So at the same time, the EIA report also approved for them to run coal power plant. Okay, we talk about plastic. Okay, averagely 2,000 tons of plastic waste will be burned in the incinerator. Okay, so I can foresee that they will have a more and more health problem that they by the people like us in Malaysia. So we're facing a big problem, which is we have to bear the medical fees, which most of the time in Malaysia, we need to go to private hospital to get better medication attention. But all these we have to bear by us. So that's why, from my point of view, if you ask me the impact, the health impact that bearing by people in Southeast Asia country, I really want to say that I don't know where is our future. I don't know how I can tell my children that they will have a good future if the import of solid waste is still continue by the developed country. So in here, I would like to call to the developed country that the waste trade should be stopped immediately, because we bear no obligation to receive your waste that due to your ineffective waste management system. Thank you. This is all my sharing for today.
Thank you for sharing the state of Malaysia's plastic recycling, or I guess burning situation here. And our last speaker for today will be Daru Setyorini. She's the Executive Director of ECOTON, or Ecological Observation and Wetland Conservation. ECOTON was established in 2000 to promote environmental justice for present and future generations, especially in sustainable wetland resource management. Its work is also focused on the link between plastics and human health. She will tell us more about microplastics in bodies of water and how it impacts our health.
Okay, good afternoon. Thank you for inviting me to this webinar. So today, as requested, I will present our work in doing analysis on microplastics in rivers, Indonesian rivers, and its impact to the community. So, why it's not moving? Sorry. Yeah, okay. So as many rivers in developing country, this kind of situation, I think it's quite common, especially in Indonesia. So rivers in Indonesia are suffocated with plastic waste. And more specific, also we have problem with disposable diapers because people throw their used baby diapers into the water to prevent from burning, because there is a myth to prevent burning of baby diapers, so the baby will not get sick. And the trash from the rivers will be accumulated into the sea. As we know, in the Indonesian rivers, there are many people still throw their trash into the waterways, and these beaches become the accumulation spot for the trash from our rivers. To raise awareness on the plastic pollution in our rivers, we invite, or we encourage community to participate in river monitoring. So we have citizen science program for youth and women, and we train them to do microplastic and water quality analysis. We do the biodiversity monitoring to indicate the water quality level, and we also do the plastic trees operation and illegal dumping mapping. With the youth student, we train them to do brain audits in their local rivers. So we use simple tool, bring the students, bring the women to visit, to come to the river and regularly do the river monitoring. With the community, we also do mapping of illegal dump site along the Surabaya River. This river is very important because our drinking water source come from this river. And we also do the mapping of the trees that being entangled by the plastic trash. So we found along the river about 20 kilometers from the upstream to downstream, there are 565 trees that being entangled by plastic trash. And some trees already died because it cannot breathe. And the brand audit result, we involve local community in Sumatra Islands and Java Island. We found that Unilever won the gold medal for the top polluters of this sachet pollution leakage in Indonesian rivers. So we did the brand audit in Sumatra, in the province, in the city of Banda Aceh, Padang, Bengkulu, Lampung, and in Java, we did the brand audits in Jakarta, Bandung, Tasikmalaya, Malang, and Madura. This is the simple tool we use to analyze or to collect water sample from the river to analyze microplastic. We call it Mystic Scan or microplastic screening can. It used to filter the minimum 10 liter of water, and we collect the substrate or the microplastic that will be attached on the plankton net. And then we analyze in our laboratory. The result from the citizen science, we found that the microplastic abundance in Brantas River tend to be increased to the downstream. So the highest concentration is occur in Gresik, where there are many recycling industry like paper mills and also plastic recycling industry. And this what the process of small scale recycling processing, to do the plastic washing, cutting, and release microplastic to the water body. So this is from the household waste, can also be collected from the landfill. East Java become a center, one of the center for plastic recycling. Many landfill operator or waste workers, and also the MRF from Java Island and east part of Indonesia, like from Sulawesi, Bali, Kalimantan, Nusa Tenggara, they send their plastic trash for recycling to East Java. So this is the toothpaste that also recycled in Jombang Regency. And this very dirty plastic trash cleaned using the groundwater and then discharge untreated wastewater with the foam and detergent, and also microplastic into the river. And sometimes we can see the incident like mountain of foam created, cover the surface of the river because of this recycling industry discharge the foam or detergent water to wash the plastic to make flakes that will be sent to the recycling industry. So the wastewater also release these millions particles of microplastic. We found this in the discharge of a recycling industry. So we can see how this dirty recycling happening. And we collect water sample from the river, found that in Brantas River downstream, we found there are 293 to 2,000 particles of microplastic per 100 liter of water sample. And we also do the analysis on the human faces. So there are 102 sample of faces from the people live in 14 cities in Java and Bali. And we found that all of the sample contain microplastic. And the average concentration is 17.5 particle per 10 gram of faces. And recently, in the last 2022, we released this report from the Nusantara River Expedition team, who collect water sample from 68 Indonesian river. And we found that there are 5 provinces that have highest microplastic particles in the river, and not only in Java. We found that microplastic also very high concentration in Sumatra, Aceh, in Sulawesi, Maluku, and also in Sumatra Barat. So this indicates that the plastic waste leakage has been degraded into microplastic, and it become more difficult for us to clean up and to control the disperse of this microplastic. And the type of microplastic we found is dominantly by the fiber. So it can be from the textile, washing, from our wastewater, domestic wastewater or laundry service, or from the hospital, like already presented by previous speaker, and also from plastic recycling. So almost 50% of the type of microplastic we found is fiber, followed by the film from the flexible plastic packaging like plastic bag, and fragment is from the PET, like the hard plastic microplastic that comes from the hard plastic. And the microplastic in the river not only come from the wastewater discharge, but also from plastic waste burning on the riverbank in the small scale industry that are being diluted into the water when the rain comes and bring this scraps, small scrap of particle to diluted into the water. As we know that, like Pua presented, this plastic waste burning really have bad impact to our health, like asthma, and also what we afraid is cancer. Like cancer rate is also increased in a village here in Mojokerto that close to the incinerator of hospital waste. So there are new 4 cases of breast cancer in the village that previously never happened. And what we have to concern about the toxic plastic chemicals and additives is that these chemicals have effect on the endocrine disrupting effect, especially to our reproductive organ, like that can cause the lower our fertility and early menstruation, early menopause, and also birth defect. So our body is controlled by a hormone, and this plastic disturb the hormone system, so it can cause many degradation in our organ. So we have to really avoid this single-use plastic consumption in our daily life, because more plastic will release more toxics. Unfortunately, the petrochemical companies are only scaling up recycling capabilities in developed country where there is strong demand for recycled plastic and economic conditions are favorable. It's unfair for us who live in the developing country. There are also many small-scale businesses of recycling that have lack of environmental measures. So we use a low grade of recycled plastic product. And developed country also produce excessive virgin single-use, because their consumption per capita, plastic waste generation per capita in developed country is much more higher than us who live in the developing country. For example, China, who's the largest single-use plastic producer by volume, produce 18 kilograms of plastic per person, while in America produce 60 kilograms plastic waste per person per year. So there's a disparity of how the single-use plastic is more used by the Western country, and they use our developing country as the recycling, as recycling place. So the recycled plastic part also have more risk of the toxic leach into the water, the bottled water that we use, like the PET bottle. So the recycled PET, a study report that the level contamination was found to be higher in bottle made from recycled PET than the virgin PET. So even though recycling is promoted by the FMCG to reduce the plastic production, but the recycled plastic also have more risk of this toxic leakage into the food and drink that package by the recycled pellets. So in summary, we can say that plastic poison the circular economy, because since the production, there are a lot of toxic chemicals that has not been regulated. So we need to push more global regulation on this toxic. So plastic can be really safe to be recycled and to be used in its the whole life cycle. And recently, there's a study of toxic additive by IPEN, and it revealed that even though the BPA-free bottle label is often mislabeled, so not all BPA-free is free from BPA, because we found that 78% of the 98 product tested with label BPA was found to be mislabeled. And also, we use a lot of waterproof textile, like a raincoat or waterproof clothes. Yeah, and it's also contain brominated flame retardant that has been banned by Stockholm Convention. We have to avoid using that kind of textile. And also for the PFAS. So these three are the most concerned, and there are availability of the laboratory analysis. There are many more chemicals that we cannot analyze because of limitation of this laboratory analysis. And lastly, for the recommendation, I think we all want to push more transparency and improve communication, especially around the production. So plastic will be safe during the consumption and the management of plastic, so we can achieve the safe circular economy for the material that safe for the health and for the environment. And the health implication of plastic contamination have yet to be properly studied because lack of laboratory analysis and lack of transparency from the producer about the list of the chemicals they use in the plastic production. And third, we need strengthen global policy to eliminate toxic chemicals in new plastics and to put the label of the ingredients, the toxic chemicals in the plastic. So we have the right to know what are the chemicals has been used in the plastic, so we can have information about the safety and the health impact of that product. And we also need to push the banning of toxic recycling. Like in my area, there are many toxic recycling facilities run by small industry. We have to have strong regulation. Yeah, we need to push our government to enforce the strong regulation to ban this toxic recycling, and also to avoid the use of plastic as fuel, because it will release dioxin and other toxic chemicals to our air, to the air we breathe. And lastly, we need to holding plastic and chemicals producer financially responsible for all the social, economic, environmental harm caused by the product through taxes, fees, and deposit return programs. So we can prevent the plastic waste leakage into the environment and provide safer working condition for the waste workers, that the expense should be also covered by the plastic and chemical producers. I think that's all I can share for you. Thank you, and we'd be love to have discussion later.
Okay. A big thank you to our three speakers, Ramon, Peng, and Daru. This has been a very informative and interesting discussion. I know I personally have learned a lot, especially that BPA-free plastic bottles are not actually BPA-free. We're opening the floor now to some questions. There's already a few questions in the bank, but please do send more to our panelists. Okay. Since Daru was the last one who presented, there's a question for you already. This question, I think it would be nice if you can clarify to this audience member. So the question is Isn't recycling the solution to plastic waste, and single-use plastic, which are not recyclable, should be banned?
Yes, thank you for the question for me. Yeah, recycling is promoted as the solution to our plastic crisis, but in reality, recycling is not effective. Recycling is not work. So recycling is still a myth because globally only 9% of total plastic production has been recycled. And because of the toxic chemicals in the plastic, it prevents the safe process of the recycling, because when the plastic recycled, it will release more toxic to the waste worker, to the environment, to the recycled product, like the study in the recycled PET I showed you earlier. So the toxic chemicals in the plastic when it's being produced, it should be regulated. Right now, we don't have strong regulation, and there are many unclear or non-transparent information provided by the producer. So we don't know what are the additives used by the producers, and we are lucky that there are some organizations do voluntary analysis to make a list of these toxic chemicals in our product, like what IPEN did. So we can push what kind of chemicals that should be regulated in the global treaty to prevent the contamination for the new plastic product. So recycling is not work. It happens in reality in my area, where the process is really not safe for the environment, for the worker, and also for the people live nearby the facility, like also Pua presented.
Okay, I hope that helps answer the audience member who asked the question. Moving on, the next question is for Ramon. It's asked, the question is, do you think communities living near petrochemical plants or plastic manufacturers in the Philippines, such as GJ Summit Petrochemical, are also at a health risk?
Thank you, Hannah, for the question. I read it, and my colleague Aaron also sent it by Viber to me. The same question. There is always the risk that petrochemical plant pose to communities nearby, and it's just good so far that there is no known incident of whether toxic emissions getting up into the soil or into the river or into the farm that we have heard so far. So what we should keep on doing is to address just like the discussion we're having now, why at some point petrochemicals should give way to more sustainable products than just extracting it, because similarly, it's also coming off from fossil fuel. So the push for civil society, for communities, for activists to find ways and negotiate and advocate for policies to replace this kind of harmful petrochemical and similar products should be sustained, such that we don't need to wait anymore for an incident to happen. Because without even an incident taking up in the communities, we know that still they're harming our climate, they're harming our environment, they're harming our own health. So it's not only the communities per se surrounding that is within the vicinity of the plant, but as well the production itself is harmful in many ways. So we should keep on opposing it. Thank you.
Okay, thank you. The third question is a question that I have for Peng. So you mentioned that the solution was to ban waste trade, but of course this seems like a top-down approach, and we know that it doesn't always feel hopeful that large corporations or the higher ups would take such an action, right? Some people might even call it radical, perhaps. Is there anything, or would you recommend the average citizen to how would they be able to contribute to this fight?
Okay, first of all is there is no sufficient treaty. Even though we have Basel conference, okay, these are of like agreement between countries, but so far it's all, like no action can be taken to, like, for example, so many smuggling come into Malaysia, e-waste, plastic waste, or a lot of things. So Malaysia just able to send back the waste. This is a human right infringed. So I think the issue should go to UN, that this waste trade is a human infringing. Okay, and the developed country, they are so high concern about human infringing. So UN should play this role to stop the waste trade. Because first of all, how come until now, when there is a smuggling from waste that deliver to Malaysia, Indonesia, all we can do is just stand back, and we bear the cost of the stand back, and no any sensation that the receiving country can do to, so for example, USA and Japan, and the government just keep quiet. The government just keep quiet. Okay, and there's already so many proof showing that the solid waste being processed in this country, no matter so-called legal or illegal way, is a huge impact to the health of the people there. Okay, so I think nowadays it's just like whether the highest organization which they really would like to implement so-called human right protection, really want to seriously take waste trade, is something like people track shopping, okay, like people track or animal, okay, people track animal organs, something like that, or illegally track humans organ. This is same serious for me, that the waste sent to us from the developed countries is really killing us, and is totally infringe our human right. So if the waste trade issue can bring up the human rights issue, that is a big issue. Now the problem is the country don't take it as a big issue. My country and something like USA, Australia, and including New Zealand, people there are so concerned about human rights, their human rights. And how about us? So I think this is something that UN should get involved, to have a better protection to us, that we as a vulnerable community here, we don't want all these ways. My country have a big problem in corruption. So it's easy to get license to run a recycle factory. When there's a pollution, we have to fight using our life, including, like, for example, a lot of a complaint from our community, which is covered up by no sign of pollution. For example, when there's air pollution, how you prove that there's air pollution? You have to spend 10,000 USD to buy air monitoring devices, and end up the data is not being recognized by your Department of Health or Department of Environment. So when talking about this, who produce the waste, who should handle by themselves? Yes, you anyone say recycle is a green industry, go ahead to produce to run in their own country. You produce the waste, you should be the responsible part, not us. But when they put a name on this as a threat, mean somebody benefit from it. Who benefit from it? Okay. So my main concern is this can be recognized as a human right infringement.
Okay, thank you for your really thoughtful answer. I tend to agree with you. But yeah, moving on, this is open to the floor. In a nutshell, can you summarize what might be the hardest challenge when it comes to breaking the plastic cycle? So again, open to the floor. Anyone can respond to this.
Well, in the healthcare sector, Ashley, we saw it in the recent years of the pandemic. When the pandemic was almost synonymous to the huge volume of plastic waste. And it was simply allowed to happen in the name of protecting us from the virus. And yet, studies after studies showed that there is an overreaction and the tendency to overprotect at the expense of our own environment and our own health. For example, in a study made by the Healthcare Without Harm globally, a typical doctor in the recent years of the COVID, in a day would use 10 pair of gloves, and all of them are disposable. And yet, when studying that pattern of when it is necessary and when it is not, at least half of that pair of gloves could have been saved. And saved both in terms of the money and saved in terms of the plastic waste that have gone through the environment. If only doctors themselves, the hospitals, and us ordinary individuals who are trying to care for ourselves and our own loved ones not to get COVID, a simple washing of hand and with soap would get rid of the virus and would protect us in most cases anyway. Similarly, in the healthcare setting. So to your question, therefore, caring for human health should be done alongside caring for the environment. And that should not be one over the other, which has been the practice in healthcare for quite a while now. And usually at the expense of our own health, because whenever we hurt and harm our ocean, our soil, our air, in the end it gets back, people gets back to the hospital, getting sick from very bad environmental conditions. So what we always advocate for is caring for environment is also caring for our own health, and caring for human health should not be done at the expense of the environment.
All right, thank you, Ramon, for your answer. There's one final question, but it is not directed to anyone, I think. So I guess it's also open to the floor. Just the last question. The question is, often governments are relying on the issue by simply announcing the ban of single-use plastics. However, it does not yield expected results as our system is incapable of substituting plastics. Apart from recycling, can we have some viable organic mechanisms to reduce the harmful impacts of plastic waste? What if we can strengthen the mechanisms to dispose plastic scientifically?
Yeah, maybe I can start to answer. I think we have to consistently choose for reusable alternatives. So we should support the prevention of single-use plastic and the banning. I think there are a lot of alternative already available out there. It's just we don't want to change because some people think it's too much work to wash, but actually if we get used to it, it will never feel like too difficult. So there are many alternatives already available. So we have to support the green business, like providing bulk store or reusable products. And even though now it's a bit more expensive than the single use, but that kind of industry need to be supported. And we also want government to provide incentive or subsidy to that kind of business, so we can provide more accessible alternative than the single-use plastic. So like disposable diapers, for example, if we have a commitment to avoid exposure of this toxic plastic to the health of the baby, and if we consider the plastic trash, the disposable trash, diaper trash that we will produce during the maybe 1 year of the baby use it. So the parents should choose for a reusable alternative. And some people think it's too many works burden for the washing. If they really committed, I think that should not be a problem. And every day we laundry our clothes, so it's just like regular clothes. The disposable diaper is like regular clothes that the mother every day has to wash. So if we committed, we want to support this prevention of plastic crisis, I think it just depends on our willingness, our commitment.
Okay, thank you. I think that will be it for the webinar session. I will now be sharing a little bit about the story grants, like I mentioned earlier, to our audience members who might be interested. So Climate Tracker Asia is inviting journalists uncovering the plastic crisis, stories of pollution and solutions. This is also in partnership with Breaking Plastic. Okay, yeah. So we are looking for solutions-oriented stories related to the topics discussed today, as well as stories on the link between plastic pollution and climate change, sachet culture and single-use packaging. Solution stories, or those highlighting how communities solve the crisis, are also preferred. So grantees must publish high-quality reports on plastic pollution and solutions before 31st of March 2023. They will receive a story grant amounting to 200 euros, mentoring, and also networking opportunities. As a former Climate Tracker fellow, I would like to say that this is a really good opportunity for anyone interested, so I guess it's highly recommended. You have to feel free to submit your pitches until the 28th of February. Applications will be reviewed every Friday, so send your pitches right away as they are only offering 12 story grant opportunities. And yeah, that's all the time we have for this session. Thank you so much for spending your evening with us, or afternoon if you're in a different time zone. I'm inviting you to join our third and the last webinar on plastics on February 28th as we discuss corporate accountability and solutions. To learn more about ending plastic pollution, visit breakfreefromplastic.org. Don't forget to read our stories on plastic and climate change on our website, climatetracker.org and climatetracker.asia. We hope you had a lovely and informative Valentine's Day. And again, thank you to all our panelists on their really thoughtful.
Can we just request for a picture together of the panelists?
Yeah, sure. Yeah, okay.
Okay, I can prompt you. I already took some photos, but Daru, maybe you can unmute yourself so the camera button won't show.
Unmute.
There you go. And please smile. I'm taking screenshots. And 1, 2, 3. Kind of look to your cameras again. And then 1, 2, 3. There you go. Thank you. I'll be sending this photo to you.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you. Thank you.